are in listen-only mode.
Hello everybody, and a really warm welcome to our webinar this afternoon. I'm very impressed how many of you are absolutely dead on time, so it's really good to see. Thank you very much for joining us. And today you're going to be hearing about our thoughts for whole family working and youth offending teams. So I'm Wendy Wheel, I'm the Managing Director of Interface, and at the moment you should be able to see me on your screen, so I'll just wave to you, but I'm just about to turn that off because as we go through it can be quite distracting. I'm also joined by Sue Eubank. Sue has been a senior manager in youth offending teams, and she's recently been working with the Tri-Borough on the development of a whole family model using a team around the family approach, which is what we're going to talk to you about today. So for those of you that are new to online seminar technology, if you just have a look on the right hand side, you'll see a panel. If you could just raise your hand, that would be really helpful so that I can see that you can all listen. So the fact that you're muted doesn't mean that you can't ask questions. If you have a look to the right hand side, you'll see a chat box at the bottom right hand corner of the screen. So if you just put in questions or any issues that you've got as you're working through it, as I'm talking or Sue's talking, I'll be collating questions and trying to respond to any issues that come up, and we've got a question session towards the end. So finally, if you've got any colleagues that wanted to join us today, I'm actually recording this webinar. So if you wanted me to forward it on to people, I can do that afterwards, or we can make it available through the website. So what we're planning to cover today shouldn't last any more than 40 minutes. And between us, we're going to provide an overview of what we think the changing needs are for staff in youth offending teams when working with whole families. We're then going to share with you the whole family model that's been used in the Tri-Borough. So for those of you that don't know anything about Interface, we're a national provider of specialist expertise. So we work all over the country, and our expertise is around working with complex and vulnerable families. We provide a lot of training and do evaluation and monitoring. So the team, we started as the Families at Risk Division in the Department for Education, and this is the sort of thing that we do. Obviously, we've got experience of working with youth offending teams, school improvement, system leadership, general improvement programmes in local authorities. But as I say, it's around working with vulnerable and complex families. So when we work with schools, we don't go in and do school improvement. It's around how they work with their families and children. So over the last 4 years, just to give you a flavour, we've trained over 4,000 frontline workers and managers, and we were the people that set up intensive family support projects. So those of you that were around in the time of youth crime family intervention projects, we were the team that came and set them up, and I was responsible for the Think Family reforms. So more recently, we've been involved in early help, troubled families, quite a lot of challenge and support, and a lot of evaluation of projects. So we know that with the expansion of the Troubled Families Initiative, and just generally with more research showing us what brings about sustainable change in young offenders and their families, we know that the focus is moving towards whole family working. So what does that mean for YOS staff? And when we're travelling around the country and we're providing lots of training, these are the sorts of things that people tell us. We know it brings about changes in the way things are done. It means looking beyond the offending and working with the whole family, with the wider family needs, and that's what brings about improvements in long-term outcomes and reduces intergenerational cycle. So what staff tell us is that change in their role, the complexities of the whole family working, means that they need new skills and to build new relationships. So it might well be that they've got to have relationships with younger children in the family or with older family members, and that's new to them. And that change in role, visiting in the home, those sorts of things can make people feel quite fearful because it's not what they've been used to. They need a new skill set to be able to self-reflect and problem solve. And they have to understand also what the wider agendas are. So for example, the early help or the troubled families agenda, how does their work fit in? They need to understand how their work brings about the outcomes that management need and also brings about sustainable change. So understanding that big picture and then what it means is quite a key issue for staff. So we've seen these are the skills that people need to develop. These are the core concepts. So when we go training on some of the specialists like motivational interviewing, we'll often see that actually it's basic engagement and communication skills that need to be improved. Active listening, asking really difficult questions, those sorts of things, keeping asking the question until you've got the information that you need. you're continually assessing. You're going into a family's home, you're observing and you're assessing the whole time. And that means that you need to have resilient workers. It also means changing the way that you record meetings, the way that you facilitate meetings, and who it is that you're working with. So those are core skills that we're regularly training in. So just to highlight a few training suggestions that we think are really useful, particularly for youth offending teams: the core concepts of effective engagement, how to engage difficult to engage families, so resistance from other family members, because you'll all know that working with a youth offending child, unless you're working with the family, you're not going to bring about that change unless you've got the family members on board. So how to have difficult conversations, influence, negotiate, assessment skills I talked about, and then how to chair and run a team around the family meetings. The other thing that we've seen a lot of is a need for tools to support work with families. So using genograms and chronologies and family stars in your conversations with families to be able to move them on. So we've created, for example, an e-learning package specifically around tools. Then it's around recording and supervision. And the supervision I'll mention separately, because we've certainly trained an awful lot of people in whole family working, and that means that they are changing the way that they work, and often the supervision practices aren't working in the same way. Supervision needs to be changed quite drastically, otherwise workers don't feel supported enough to be able to work in that whole family way. So that's just a highlight. There's a lot more that I could talk to you about, but without further ado, I'd like to hand over to Sue, who's going to talk to you about the whole family model that she's used in Triborough. So over to you, Sue.
Okay, thank you very much, Wendy. Good afternoon. My name is Sue Eubank, and I'm very pleased to be presenting the Youth Offending Service whole family model today. I have recently spent the past 11 months working in the London Triborough, which is Hammersmith and Fulham, Westminster and Kensington and Chelsea. I've been developing and then implementing this model of work. Prior to this, I managed Hammersmith and Fulham YOS on an interim basis for over 19 months. I've worked previously in Islington, Croydon, Merton and Lambeth, both in youth offending and in social care, and my background is as a social worker. I was asked to do this work as I have had experience as a senior manager in youth offending for a considerable number of years and know what the issues are for everyone working within this environment. And one of the most key things I was clear about from the outset was that we needed to have a model that would enhance our work, best meet our needs as a yacht service, and achieve better outcomes for young people and their families. The young people and families we focused on in our pilot were our resettlement cohort, as we were concerned about custody figures and reoffending following release. As we know, this is the most crucial time for those young people, so getting a plan together for the whole family is key. However, this model can be adapted to work with all young people who come into contact with the youth offending services, and from some of the feedback we have had from parents following the team around the family meetings are comments like, "Why now? We needed this to happen sooner." Okay, I will now take you through the model very briefly, and we'll be happy to answer any questions at the end. Okay, so the context, just back one, Wendy, the Triborough context, thank you. Okay, I think another one back. The first one, lovely. Okay, thank you very much. Okay, wanted to put it a little bit in context for you all, why I was asked to do this work across the Triborough. Within the Triborough, there is a focus on practice initiative which is being rolled out over the next 2 to 3 years in the whole of family services, and this includes the youth offending service. And the aims were to establish effective practice which delivers sustained change and better outcomes for families, develop a whole systems delivery of evidence-based interventions, and move to an intensive casework with smaller caseloads. Now, the training around this, there's lots of training going on in Focus and Practice, but it's that yacht workers were being trained alongside social workers and other workers to be able to deliver the same interventions. And this is around systemic practice, child protection and safeguarding, and delivering some parenting interventions. Okay. Okay, next one would be lovely. Okay, I was asked to look at the existing assessments that were around, the processes and procedures, and obviously we had a team around the family which was primarily being used in Westminster, so I very much looked at the model that they were using. They were using this as a pilot in their localities team, so we were able to tap into some of their training for managers. My job was also to consult with managers and staff across the Tri-Borough yacht, and to pilot and evaluate. This says at least 6 cases, but in fact, because our pilot was extended, we piloted 12 resettlement cases across the Tri-Borough. So it was really to do 4 cases in each borough. I took on the chairing for the whole family TAF meetings in each of the different systems, which I'll come on a bit later. I had to review caseloads that were around for our workers, and I considered management capacity, obviously what the training needs would be for the whole staff team, and what the resource implications were. Okay, Wendy, thank you. Okay, so why are we doing this? Why are we doing this, the whole family? And I think, I'll go over this because, thinking about it myself, we kind of, we get very focused in youth offending on the young person. So, and to talk to, when we're talking about this to our workers, it's talking about being frustrated by wanting to do more as a YOS worker in a service. We can rarely fix 1 or 2 things to make everything better. Our young people do not live in a vacuum. It needed a shared, coordinated think tank approach, particularly around risk factors. Families not being swamped by professionals, to be very clear about who was involved with the young person and the family. It needed to be a transparent process, so the family are very clear about the work that the youth offending do. And as we know, our parents, carers and families are often very suspicious about, youth offending, courts and everything and what we're doing. And why? Voice of families, much more present. Families taking responsibility for their young people and to take on that so that it will enable the young person to complete their court order or licence. Sharing of skills between professionals, this is a key one. Parenting workers sharing their skills with your officers and social workers. Culture considerations, always been at the forefront of our work. Okay, and I think this is very important as we work with many, many families from very different cultures. Okay, what else does it do? It looks beyond the immediate presenting problem and works with the wider family needs. That's extended family. It helps to reduce the intergenerational cycle of poor outcomes, and we all know about the cycle of what happens and our young people living within that cycle and not being able to break out of that. It recognises that the referred person exists within a larger set of complex relationships. It allows interventions to be connected to the systems that most influence a person's development and behaviour. And it enables, and this is really, really important, it enables families to build on their own strengths and resilience in order to make changes and influence and help that young person complete their order and complete their licence or whatever they're on with us. Okay, thank you, Wendy. Okay, when we started to do this, we had an event for our managers in the Tri-Borough to really kickstart this off. And what we wanted to do, we wanted to hear from them about their concerns. And these were some of the concerns. And it was around management capacity to actually take this on board, because managers were saying, we chair, we go to enough meetings as it is, can we really do any more? Being dumped on by other professionals and services. When I say being dumped on, I mean, how often have we heard within the YOS that if a young person comes to the youth offending service, social care may close the case and leave it over to youth offending. How will the whole family approach become a shared responsibility across family services? So our partners taking it on board. I mentioned closure of cases open to social care, and that was a key one, as I say, for managers as well as our youth offending workers. Concerns were also around clarity of role and responsibilities of professionals, so we needed to be very clear about who was doing what. Caseloads and capacity, skill base of workers. If the workers were being asked to do additional duties, i.e. parenting assessments, did they have the skills to do this? Yet another assessment. As we know, we do lots of different assessments. So again, it's what additional work would that mean for the team? Data and recording processes, how would this happen? And I mentioned training implications, because we know in youth offending, at the moment we're kind of bombarded with lots of different training. So it was those are the things that we needed to work through. And what I did, I worked through them with the managers to enable them to take this pilot and model on board. Okay, this is a visual of the model, because I think it's really important for you to know how we went about this. And I'm going to actually go through the details of the meetings in the next few slides. But number one on this is about cases that need to be identified to be considered for the TAF process in the Youth Offending Service. Now, we did our resettlement cohort, but this, as I said earlier, can be easily adapted for every young person that comes into the yacht. It's just, I think, if you've got a key cohort of young people that you want to focus in on. I mean, in Hammersmith and Fulham, we were very concerned about 10 to 14-year-olds, and the next cohort will be, for our TAF process, will focus in on those 10 to 14-year-olds. But as I say, for us, for the Tri-Borough, the pilot was our resettlement young people. Okay, thank you, Wendy. Next one. Okay, so to start off the process, we have something called the pathway meeting. Okay, now this is where we get key YOS professionals around the table with the manager to decide whether or not to go forward with the TAF. And believe it or not, even with our pilot cohort, we did have some people, when we sat around the table, that it was not suitable for, but for most it was. Okay, so we sit and talk about that. At the pathway meeting, if we're going to go ahead with the TAF, we decide upon what assessments are needed. Okay, and this always kick-starts a new parenting assessment, because we need absolute up-to-date information to start this off. We also consider any other assessments that would inform the pre-TAF, and other assessments that we commissioned have been around. We've commissioned a psychology report, we've asked for a drugs report, we've also asked for additional reports from education partners. We agree who else should be invited to the pre-TAF, because the pre-TAF is where we have lots of other professional people around the table. So we agree at that meeting who else should attend, and it could be that we have housing, we have other professionals that are involved with the whole family. We also agree timelines for the pre-TAF and the TAF, so we know how long the process is going to take. And obviously, if we've got a young person coming out of custody, we are tied into very tight timelines. And as we know, we need to get these things done very quickly for young people and families. Okay, thank you, Wendy. Okay, so we go on to the pre-TAF, which is the wider professional network. Now, I mentioned timelines. The pre-TAF would take place normally 4 weeks after the pathway meeting to enable all those assessments to be with the professionals, and for myself as chair, facilitator, co-facilitator, to have had sight of those assessments and considered the information. So at that meeting, we share all of those assessments. We also share all concerns and risk factors. This is all child protection, safeguarding and risk factors around the young person and the family. We iron out, as best we can, any professional differences before the TAF with the family. Now, I say this because what we don't want when we meet with the family is professionals to be arguing amongst themselves. Now, we appreciate that professionals all have very different views, but we need to come to an agreement with the family. So we try to iron out as best we can what the differences are before the TAF with the family. Okay, and then at the pre-TAF we decide on who the most relevant key professionals are to attend the TAF, because what we don't want for the team around the family meeting is for 15 professional people to be sitting around the table and there are 2 or 3 family members, because it's very daunting for those family members. So we have the key professional people at that meeting. Okay, thank you, Wendy. Okay, so the very important meeting is the YOS TAF. And again, this is the young person who is on the court order and licence, their family members. Who are the most key family members? It could be mum, it could be dad, it could be gran, it could be aunt and uncle, grandmother, grandfather. We know that our young people come from, a good mix of families. So, and we've had 2 members and we've had 7 members of the family attend our TAFs, which has been quite fantastic. Needs a lot of handling, but it's been an interesting experience, and obviously the key professionals. Now at the TAF, we decide upon the actions to ensure the young person has a best chance of completing their order, and the family have proactive support with any problems that they are facing. So that's where we're looking at the whole family. So I will ask, the family, I will know who the other family members are, and I will ask, particularly if they're under 18, how are they doing? How is, the young person coming out of custody? How has it affected the family, etc. Okay, it's really important at that meeting to discuss current risk levels, because we know that on the risk of serious harm and vulnerability, we have a risk level. So it's key to share that information with the family. Okay, so that we're not just holding it. We need to let the family know what our concerns are over the risks, and to get them to interact with us. And one of my great bugbears has been, do the family know how concerned we are about this young person? And quite often it's been, no, they don't, and we really don't want to tell them, but they need to know. So again, it's we need to be very clear at that meeting. At the meeting, we identify a lead professional. I've put professional there. It could be 2 professionals, and I say that because mostly it's a youth offending worker, but if there is a social worker involved, then we have co-leads, and they are co-leads, so it would be 2 people. Okay, and then we would plan a regular review from the TAF, which would be in line with the risk level. Now, if a young person is deemed as high risk, we would have the review TAF in a month's time. If they're medium risk, we would have the review in 6 weeks' time. But there is no real, if you wanted to have a review in 2 weeks, then a review would happen in 2 weeks, or indeed 8 weeks. It really depends on the circumstances of that young person. Okay, thank you, Wendy. Okay, now this could lead to less meetings. Less meetings, okay, we were combining intervention meetings in the team around the family meetings, because out of the TAF comes a clear plan for that young person, as well as actions regarding the other members of the family. It could also, the other meeting that we toyed with in the Tri-Borough was whether it could replace a risk panel meeting, and this we're still deciding this, because in some instances it can, in others it can't. But what we were really keen to do is to have less meetings. It can also, we have professional meetings. I don't know, different boroughs call it different things. So obviously this is, this can actually be in place of that. So less meetings is a real key one. Shorter court orders, early revocation. If we've got the family on board, it's a recipe, hopefully, for success, that they will support the young person to complete the order successfully, and we can actually, wouldn't it be lovely to take these young people back for early revocation? Okay, I mentioned sharing the work, and the risk is absolutely key. Parents and carers need to know about what their young people are kind of doing out in the community, and how we view that, and how we actually assess the risk. Ensuring that exit plans are in place for the whole family. This is really important because obviously, yeah, these youngsters that we work with are on time-limited orders. But if there are other things that are going on in the family, we need to ensure that there are clear plans in place for the family to enable them to have, you know, further support, to bridge them over to other services. Okay, it could lead in an overall reduction in reoffending. This is a main thing for us in the Tri-Borough. Reduction in sibling offending, and I think this is a really key one, because how often have we, you know, looked at the family and you look at the name and you think, oh gosh, I worked with that young person's brother or sister a year ago, 2 years ago, whatever. They're coming up in the ranks, which is not great. If we can do some early identification of those siblings, then it's key for us to put in some kind of intervention to bridge them over to services, our early help partners, our localities teams that can actually focus in and work with the siblings. Okay, it could be a reduction in young people becoming looked after, and a reduction in costly remands, because we pay for that. It's very expensive for local authorities now, and I say that because if we know from at an early stage about extended family, then we are better placed to actually, in times of crisis, to actually go to other members of the family and ask them to help, you know, have that young person maybe come to stay with them. So if we've got that information at an early stage, then it can only be a win-win situation, and it could actually have that reduction in costly remands. I mean, better outcomes for young people and families, more home visits, and I put inspections by the side of that, because when yachts have been inspected, I think quite a few, there have been kind of comments made that we are not doing home visits as often as we should. And I think, you know, it's really key that we see where these young people are living, or indeed for our resettlement young people coming out of custody, where are they going to sleep and live? And dare I say it, job satisfaction. Thank you, Wendy. Okay, so the pilot, what has gone well? Okay, your support of process. I mean, I think, as I mentioned before, we had a half day for managers that really kick-started this process. And then what I did, I went around to each of the staff team meetings to go through the model with the team members, and I did presentations at a Tri-Borough away day. And, you know, workers were really enthusiastic about this, and, you know, many of them said to me, "Sue, we used to do this before, we've kind of just forgotten it along the way," or it's just really nice to be, you know, back thinking family, because, as I said, you know, quite often we're focusing on the young person alone. Okay, information sharing has gone really very well, particularly at the pre-TAF stage, where we're getting all the professionals together. Assessments of the family. The assessment of the family, the up-to-date assessment that we asked them to do, was completed by our parenting worker alongside our youth offending worker. So they went out to that family and did that assessment together. The pathway meetings and pre-TAFs, as I mentioned, they went really well. We had amazing attendance at meetings, and I quoted a family coming along, and I think it was about 6 or 7 of them, which was absolutely fantastic. And professionals have been really great at attending. Briefing parents and carers. At the beginning of the TAFs, it's a really key thing that I've put in place, to spend 15 minutes with the parents and carers and that young person on briefing them about what we're going to be talking about during the meeting. It's key, so that there are no surprises for those parents and carers, and they have appreciated this. We also do a debriefing with them following up directly after the meeting, just to check out with them that they've understood everything that we've spoken about. And we've actually developed a document that we can actually give them following the meeting. Okay, TAF meetings, different way of engaging parents. And it's been acknowledged that this is a really good way of engaging our parents. And identifying lead professionals. this has been really key, because how often in cases do parents or carers sort of ring 6 people and get, maybe get different answers from different people. What we try to do is say, this is your lead professional or professionals who are working with you, and everything should go through to them, because it can get confusing for our families. Thank you, Wendy. Okay, so what hasn't gone so well? Okay, sometimes partner involvement. We've had an example of our education partners actually agreeing a plan for the young person, and then the TAF happened and they took that offer away, which was absolutely scuppered the plan for our young person, who was actually sitting there wanting to go to school, saying he would go to school, but the offer was taken away from him at that point. So we were really concerned about this. Early intervention, again, we had an example of a young person where we looked at the asset that was written over a year ago that actually identified everything that happened to this young person. There were all of the risk factors there. Had we intervened earlier, or had there been early intervention, we may have prevented this young person going into custody, and is now actually serving 4 years custody. So it's an absolutely tragic kind of example. But had we, and that's why we looked at, what had gone on before, and we found that. The exit process, again, we're working on this, and it's about working with the adult services around kind of, they're taking on board what may be going on for the parents if we're talking about mental health issues. Okay, professionals not being clear about the process and their roles and responsibilities, and as I mentioned earlier, it's about, okay, the youth offending service have taken on board this young person and family, we're going to close the case. And we actually had a social worker sit in our meeting and say, no, I'm going to close the case, Sue. I said, well, hold on a moment, we need you to keep it open for, the agreement was then we keep it open for 4 weeks or so, but there needs to be some more work done around this. And I think from a senior level downwards, we need to have clear understanding about what these team around the family meetings are about. And then piloting the most complex cohort for us, because our resettlement young people are not the easiest of young people, and quite often have a history of offending, and so they're really angry when they come out. They're really, really they just want to kind of get on with things, maybe as they did before, but it's they're not the easiest. But we had, and I think, as I mentioned earlier, the preparation with the parents, carers and the young person before the meetings. For an example has been the timing of the time of the meetings. When a young person has said to me, how long will this meeting go on for, sir? And I said, about an hour and 20 minutes. Hour and 20 minutes? No. But I can't sit here for an hour and 20 minutes. So I now say 55 minutes, and but we've got to be highly focused, because we do know that the concentration span for our young people is not always great. So, but we've actually they've actually sat in the seat and they've participated. But as I say, it's not been easy. Thank you very much. Okay, Wendy, thank you. Okay, the learning from the process. Okay, many of our young people that we did in the pilot were in alternative education in one form or the other, which is an interesting fact. Absent fathers, we found that a couple of examples of our young men living within a female household, and the only person that they would take very much notice of would be their dad, who was not actually around at the time. And we had a very, very good good example of this, whereby we desperately tried to locate the dad, and we did, but we had to go through kind of many weeks of locating the dad, but he did actually come on board in the end. But it was in Westminster, in localities, the pilot there actually had this also come up within their pilot, so it's interesting. And I think one of the learning points for us is that if we know this at an earlier stage, let's make some efforts to get dads back involved with their young people. Okay, involvement of social care, I mentioned that earlier, not closing cases and actually taking on board the safeguarding and risk factors, and I think that is so important and so clear, in that these are child protection issues in many cases for our young people. Okay, diversity and culture. Okay, ask the family what this means for them. We work with many different families from many different cultures. We don't know everything. We just don't know unless we ask the family. When is the meeting? When will it best be convenient for them? What does it mean for their family and their community about what has happened to their young person within their community? Ask the family, and they will tell you. Okay, always use interpreters. Now, I put this one down because it's absolutely key. We were scuppered at one of our early TAFs in, oh, don't worry, the daughter will be the interpreter, who was over 18, and we kind of took this, but we found she withheld information, and it was to do with the dad, who was estranged from the family. So it was a very harsh lesson for us to learn. Good job it happened early on in the process, because was always use an independent interpreter. The families do have issues with this, but I think it's around talking about why we need to do this and for it to be independent. Okay, and go nicely then into translating relevant documents for family members who, English is not first language. They have really appreciated the relevant documents being translated for them. And that is the key document that comes out of the TAF, the document that says about the actions for the young person and the actions for the family, as well as the invitation to the TAF. Okay, no surprises within the team around the families. I mentioned earlier about how the education information kind of scuppered one of our TAFs. So kind of, and that was very much my job. So I would talk to the professionals, talk to the family beforehand. So I would be aware, and hopefully there would be no surprise information coming through to that TAF. Okay, early indicators for risk factors were there. I spoke about this earlier. And the need for business support to enable this model to work. The coordination of these meetings is quite a task. So if we can get business support, and indeed our head of service that allowed us to have half-time business support, which really helped the pilot along the way. So that was the learning. Thanks, Wendy. Okay, before any questions, I'll be happy to answer through Wendy. I just wanted to say that during this process, I kind of developed templates for the parenting assessment alongside my Troubled Families colleagues. And it's really quite a simple assessment, just asking very key questions that would help along the way. But it's as a template there. And there are templates for agendas, prompts, ground rules, etc., the whole process. And there is a step-by-step guide for managers and staff. Okay, thank you very much for that. I'm now going to hand over to Wendy. Thank you very much for listening to me. Bye-bye. Thank you.
Okay, thank you very much for that, Sue. I have got quite a few questions. I've been struggling to keep up with turning the slides because I've had so many questions that I've been answering as we've been going along. One for you, Sue, is about how much did this cost in terms of extra money, and then have you got any idea about cost savings? I wonder if you could answer that one, please, Sue.
Hi Wendy. Hi Wendy. Thank you for that. Okay. The cost, and I guess I wonder if the question was how much did it cost? Because I did the job, okay, so I was asked to do this by two heads of service, the Triborough Youth Offending Head of Service and the Troubled Families Head of Service, okay, and the Troubled Families Head of Service actually funded my work for 6 months, and then the other few months were funded by the Youth Offending Service, and we had some mayors funded MOPAC money, and it came out of that money, and that money was specifically focusing in on our resettlement cohort. So it was, and the mayor's office are really very keen on whole family working. So it was really, it became one of the actions within their plan, and so that's how it was funded. I did the training, so that came out of my course. So yeah, just me really. And as I mentioned, the business support didn't come to us until the last 3 months of the pilot. So business support 2 days a week for that, so whatever costing that was. So in actual fact, it wasn't an awful lot of money for the pilot. Now, cost savings, I mentioned before about remands to local authority and stopping young people being looked after. If we know about extended family, then we will actually be able to place our young people in times of crisis with extended family or other members, and stop these costly remands and young people being looked after. We've also, I mean, cost savings has been, we've had, I mean, we know about our young people being on remand and then they've got lax status, and we've certainly had within one of our team around the family meetings where the young person was placed in supported accommodation, which costs the local authority a lot of money. And Dad actually said at that meeting, if you actually abide by everything here, in a month's time you can come home. And that meant that it would save an awful lot of money for the local authority. So there are a few things. I mean, good exit plans kind of help so that, you know, families don't become dependent upon local authorities, and shorter court orders.
Okay, thank you very much for that, Sue. Somebody's also asked a longer question about tips to engage difficult to engage families, and I've been thinking about it, thinking how do you answer that quite quickly, because of course there's lots of reasons that families are difficult to engage. This is wider family members, sometimes because they think they're being criticised, that they're being a poor parent, or they don't think they're as bad as everybody else, or they did the same themselves when they were young and can't see the problem, or they don't want people involved. And I suppose the answer is it's a different response for all of them. But when I talked earlier about active listening and reflection, I would think that's got to be the first thing. Just listen and listen, even if they're ranting. Listen, 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 and reflect back to them. That sounds really frustrating. That sounds really hard for you. And then basically try and build their trust by repeating back what they're saying. You're telling me this has happened, you're telling me this has happened, and you're obviously feeling very frustrated, or, you know, whatever it is that's not too sarcastic. Tell us how it all started, those sorts of things. And then the tools that I mentioned in terms of using genograms, trying to get them to open up about their whole story or their strengths of relationships. Who is it that's supportive in the family? Is it grandma? Is it Auntie Flo 2 doors down that's going to be able to bring about change for the families? But that's not, you know, we could talk about that for a day, if not 2 days. So I'm hoping that's given you a couple of bits, but I'm happy to talk offline about that or talk to our people that run the training. But the other thing I'd say is about being clear about what your role is. So I'm here to do this, but I really want to help your whole family in order to achieve these outcomes, and being really clear about what you're going to share in terms of safeguarding concerns, what your role is legally, all of those sorts of things. So I don't know if you want to add to that, Sue, because it's like one of those multi-million-dollar huge questions, but feel free if you want to add anything to that. I think Sue might still be muted, but what I'm going to do actually is go on to the next question, which is for Sue, and that's about who has completed the parenting.
Oh, sorry, Wendy.
It's fine. Can you also, when you finish that, if you're going to add to that, talk about who's completed the parenting assessment, Sue? Thank you.
Hi, I'm sorry, Wendy, I muted myself. Can you hear me now?
Yes, yeah, I can hear you now.
Hello?
Yeah.
Okay.
Yeah.
Okay. Okay. Just a little bit about the preparation. Is that okay? Shall I do that one?
Yeah, that's fine. Yeah.
I'll do that now. Okay. The preparation. Okay. It's really key to prepare our young people and families, and this is done from the very first at the path. When we have the pathway meetings, we say to the yacht officer and to the parenting worker, prepare the family now. Ask them and tell them about the TAF and tell them what it's about, so that they know what the process will be, and just to get them used to the idea that they're going to be sitting in, you know, a room with other professionals. And as I mentioned earlier, what I do is to have some time with the family and the young person, at least 10 to 15 minutes before the meeting happens, okay, so I can actually alleviate their kind of fears and concerns. And if they're coming in, I mean, our parents, you know, luckily they weren't really angry, they were just a little bit nervous about what was going to go on. But, you know, we could have families who would be very angry. And I would expect our parenting workers and our yacht officers to kind of say, Sue, this is how they're feeling at the moment, so that we all know, you know, what may happen. But I found it, I can't tell you enough how that preparation time has been so useful, not only for the young person. And, you know, one of my main things to say is that we don't want you to go back into custody. You know, we don't want this for you. And, you know, people actually sit back and think, oh, okay, you actually, you know, you care about me. And that is absolutely key. So it's all the way through the process. You know, our workers need to prepare families and young people. Is that okay, Wendy? And you asked me something else. I'd forgotten.
Thank you. One was about parenting assessments. Who completed the parenting assessments?
I can't hear you, Wendy. Okay, about parenting assessments?
That's right, yeah. Who completes the parenting assessments?
Okay, the parenting assessments were completed by the yacht parenting workers alongside the allocated youth offending officer, because of all the background that worker would have. So they would go and do the joint assessment at the family home.
Okay, thank you. And then the last question from Karen at Hertfordshire is, how do you measure the impact of the support stroke intervention?
Hello, can you hear me? How do we measure the impact and support? Okay, we are doing an evaluation on our resettlement cohort, and again, this is around, have we stopped the young person reoffending? Has the young person actually completed their licence? This work, we are still evaluating this, and this will be done by the end of, let me see, the end of November, I believe. We've got to give some figures in. An early indication for resettlement cohort that is kind of 50-50, if I'm absolutely honest with you, because of the entrenched kind of behaviour. But we've had some amazing successes during the last kind of 3 months. So I'm kind of saying 50-50 at the moment, but it may be 60-40. But as I say, this is the most complex cohort that we've got, and you know, my mind says if we do this at an earlier stage, we stop our young people coming through. Now, how do we measure this? It's actually really difficult to measure it, but as I say, we will be getting some figures out for the resettlement cohort, because the pilot is still actually going on, because we've got to hit all the resettlement young people. Yeah, okay, is that okay, Wendy?
Yeah, that's lovely. Thank you very much, Sue. And we'd be happy to talk to you afterwards. So I've got this slide here that says, how can we help you? And we're very happy to talk to you after the webinar. So there's 2 or 3 people that have been asking me questions that I think are quite specific. And I'm very happy, as is Sue, I'm sure, to talk to you after the webinar. Obviously, we're available to provide training for you, but this isn't a sales pitch, but obviously that's a lot of what we do. And we can also support you, if you'd like, through Sue, to set up a family model that works for you. Obviously, I'm hoping that you'll understand that we now understand your issues and challenges, and we'll work with you to create a bespoke model if that's something that you're interested in us helping you with in your area. If you'd like to contact us following this, you'll probably know the website, interfaceenterprises.co.uk. There's a couple of email addresses there, either of which will eventually come through to me through admin support, or just give us a call on that telephone number. We'd be very happy, either of us, to talk to you. So finally, I'd like to just take the opportunity on behalf of both myself and Sue to thank you very much for joining us today. I hope you found it interesting and informative, and please do contact us if you'd like any further information or just to have a chat. Thank you very much again, and goodbye.